Please use the name you submitted on your registration form when you enter the Zoom session. If you do not know how to change your name, please share your name in the chat and we can update it for you. For your best viewing experience, please select the speaker view found when you click on the icon to the top right of your Zoom screen. And finally, we recognize that changing Zoom sessions may be a bit jarring, but we would like to keep our attendance reports as accurate as possible. I hope you all have something nice to eat and drink as we are ready to settle into a nice afternoon session. I look forward to eating some spaghetti carbonara soon, a recipe that was shared by one of our steering committee members, Freddie Jaimes, who is originally from Colombia but lived in Italy. So you know it's authentic. This weekend, I hope to dedicate some time to making Persian baklava, a recipe shared by Dr. Fariba Ansari. Dr. Fariba Ansari, who is originally from Iran, but who has lived in El Paso for 25 years. These recipes and more will be provided to you in the BLC Border Calendario, which will be sent to you electronically after the conference. We would like to continue showing you a bit of love from our hearts and homes, as we cannot be with you in person to share an abrazo or a hug. I must admit that as the chair of the conference and giving the welcome sessions, what I miss most is being able to lead you in a chant. Those of you who have attended past conferences remember ánimo or todos unidos, and I greatly appreciate you for joining me in those chants. I know for some of you, it may be uncomfortable chanting in Spanish if it is not your native language, but to be honest, it's not mine either. My mother worked as a bilingual teacher for 30 years in El Paso and the Coachella Valley. When I asked her why we never spoke Spanish at home when she spoke Spanish so fluently at work, she shared her concern that I would be bullied by teachers at school the way that she was growing up. Today, my son is in a dual language program where his class is actually taught completely in Spanish. And while my son engages in online learning, I listen to the incomparable Señora Ovaez from Eastwood Knowles ask, ¿Todos de acuerdo? Which in English directly translates to, do we all agree? In Italian, todos de acuerdo, or do we all agree, is tutti de accordo. Although mafia movies have always taught me that the word was capiche. In Farsi or Persian, the language spoke in Iran, where Dr. Ansari is from, the term is shoma famidi. If you spoke a different language growing up, please feel free to share them in the chat. What does all agree mean to you in your homes? This helps to serve as a reminder that we are a multi-ethnic, multilingual community on the border. ¿Todos de acuerdo? Do we all agree? Todos de acuerdo resonates with me, especially now, because I feel it asks for mutual understanding. And this sentiment is important, mutual understanding, as we communicate primarily through monitors and electronic speakers. Todos de acuerdo? Do you understand me? Do you feel what I'm feeling? Most importantly, I believe that todos de acuerdo really speaks to the intent behind this panel. There is so much misinformation affecting our communities today. It is our responsibility to learn everything we can from medical experts so that we may share this information with our families, friends, and students, recognizing that to many of them, because of our work in education, we are also considered authorities as well. We need to find mutual understanding and agreement to better protect ourselves and each other. ¿Todos de acuerdo? And now for the lecture at hand. It is my great honor and privilege to introduce you to Loreli Ambris, who will serve as our moderator for today. We greatly appreciate her efforts in organizing this panel, as without Ms. Ambris, this would just not have been possible. Loreli Ambris worked nearly 10 years as the Alliances Development and Knowledge Management Specialist for the Pan American Health Organization at the Regional Office of the World Health Organization on the US-Mexico border. Currently, she's an associate professor and librarian at the El Paso Community College, where she is the head librarian of a dual mission academic and public library, known under the titles the EPCC Northwest Campus Library and the Jenna Welch Community Library. Simultaneously, Loreli also serves remotely as an adjunct faculty for the Arizona State University Edson College of Nursing and Health Innovation and its WHO Collaborating Center to advance the policy on research for health. In 2007, she was profiled in the special edition of the Library Journal, Movers and Shakers, due to her outstanding achievements and commitment to the information sciences profession. The Library Journal noted her as one of the 50 librarians making a difference. And in 2017, she was recognized as the Librarian of the Year by the Border Regional Library Association. She's the 2018 bronze winner by the National Council for Marketing and Public Relations for producing one of the best annual reports in higher education. Please join me in welcoming Loreli Ambris as our moderator and leader of our panel today. Thank you, Loreli.
Thank you so much for the invitation to participate in this. Thank you. Well, and it is my pleasure to introduce a great panelist. I'm gonna, no preference or order, but I'm gonna start with Dr. Jose David Burgos, who is a board certified in internal medicine and the medical director for UMC Hospital Program. Prior to joining the UMC Hospital Program, he was an assistant professor of internal medicine at the Texas Tech University School Center, Paul Foster School of Medicine. Dr. Burgos graduated with honors from the Universidad de Carabobo Medical School in Valencia, Venezuela in 2003, and completed his residency in internal medicine at Texas Tech, where he also served as a chief resident. Before starting his residency, he went on to complete a cardiology research fellowship at the University of South Florida, as well as a postdoctoral research fellowship in gene and stem cell therapy in ischemic heart disease. He has a very interesting career, and he's also been you might have seen him in the news, very involved in the COVID pandemic and response. So another panelist is Viridiana De La Fernandez. She serves as an associate clinical data team lead at PPD, a clinical research organization with the mission of improving health and helping customers deliver life-changing therapies. Viridiana has been working on clinical trials since 2010 in phases 1, 2, and 3. After graduating with a degree in biology from Autonomous National University of Mexico, UNAM, in 2009. She worked as a research assistant at the National Institute of Neurology and Neurosurgery. Since then, she has worked at other clinical research organizations, CNEOS and PRA, where she also worked in clinical studies and development of new treatments. Thank you and welcome. Also, would like to welcome Dr. Mina Hydarian. I hope I said your last name correctly. Dr. Mina has been board certified in family medicine since 1995. From 1995 to 2010, she has thriving medical practice in Albuquerque, New Mexico, and was nominated by her peers as one of the top 10 doctors in the Albuquerque Journal from 2007 to 2010. While in Albuquerque, she helped to create the Women's Health Care Center at Presbyterian Hospital and served as a member of the Executive Council of the Presbyterian Health System. Dr. Hydarian received her medical degree from the University of Santiago School of Medicine in Santo Domingo, Dominican Republic, and completed her family practice residence at the University of Texas Southern Medical Center in Dallas. Dr. Hector Ocaranza. He is the City County Health Authority. He's a dedicated expert who has proactively addressed the coronavirus pandemic and ensured the provision of other essential public health programs and services to our community. He and his team are leading a transformation of DPH, aligning staff and management with a future-looking vision to provide exceptional customer service and care for our community. Since our fight against COVID-19 began, Dr. Carranza has become the face of information and guidance about the virus and how we may stay healthy, protect our loved ones, and continue to live our lives safely through the pandemic. Dr. Carranza, a Borderland native, educated in Ciudad Juarez in Texas, has served as a health authority for more than 12 years. board certified in pediatrics. He has extensive pandemic response experience as an integral member of the BioWatch program. He created the protocols for our public health aim. He served on our Ebola preparedness team, tuberculosis outbreak response, and H1N1 influenza pandemic response team, for which he developed standard operating procedures. We also were supposed to have Dr. Federico Gerardo de Cosillo, but he's in a very important mission in Venezuela. He's a Pan American Health Organization, World Health Organization country representative for PAHO WHO. And right now, as we're speaking, they're in a meeting with the US government about COVAX and vaccination. So hopefully they can go through and that country can get started those vaccines. Maybe Dr. Burgos also knows about what's going on there since he's from there. So welcome everyone. And I'm really, really delighted to have all of you here. So we're gonna, I don't know, before we start, if any of our panelists wants to add any comments or questions before we start? No? You're all ready? Okay, I see the thumbs up. Okay, so the first questions, and there's no preference on how who answers first. So I'm just gonna let one of you jump in. So the first question is, what are some of the challenges in creating treatments or vaccines for children? Can any of you highlight the challenge in adults versus children in the creation of these treatments? Who would like to go first?
Pick me, sorry.
Okay, great, thank you.
So the challenges that we have developing vaccines, and not just vaccines, but doing research in children involves a lot of ethical issues. The same way that it's going to be created or approving any kind of medication or any research in pregnant women, in children, we involve the parents' consent or the teenagers' consent, but also the way that the children respond to medications or biologicals. It is another one of those issues that we need to be extremely careful. So research done in children, it involves a lot of the process and a lot of security and safety measures that need to be in place before we do any kind of research. So basically, you're going to be seeing some of the medications, some of the biologicals, or the research that is going to be done in adults. And later on, as you can prove the safety and efficacy of some of the medications or some of the research that you're trying to prove, then you're going to be moving to the pediatric population.
Thank you, Dr. Ocaranza. Dr. Burgos?
Yes, another issue is, well, by definition, clinical trials are not very mainstream up until maybe this past year when people started the discussion about a vaccine and how we need a vaccine and how we need medications. But we have been doing clinical trials for one way or another for the past 100 years. And we have evolved in the way they are done and the way the protocols are developed, mostly ethically. That's the greatest evolution of clinical trials, but they have been out of mainstream media up until now. And there is always a mistrust. So imagine a person, an adult, accepting to participate into a trial when nowadays we have so many conspiracy theories and social media theorists also spreading news that are not necessarily true, and now putting a kid through the same thing where a parent now has to decide to make their kids go through this. So that is definitely the greatest challenge. How do you enroll a pediatric patient into a trial, going through all the wave of misinformation that we have nowadays? We have a lot of information that is readily accessible, but people will have to really digest and understand where this is coming from. And unfortunately, if you don't have a certain degree of education, maybe it will be difficult to identify if your source is valid, if actually the opinions that you're reading are actually truthful, if they make sense, if something is safe and actually is useful at any point in time. So that is another challenge to do trials in underage people.
Thank you, Dr. Burgos. Ms. Fernandez or Dr. Hydarian?
I agree with my colleague. It's more difficult to do any clinical trial with in children, especially the need of the consent from parents and also the social media giving false information about the vaccine, and that creates distrust among people, and especially parents, and they don't want their children to be in trial. So hopefully, but after the vaccination of adult and they see that it is safe with this new way that they have created this, it's not from the live virus or deactivated virus. So it's the trust of the community. We can regain the trust of the community, and then we can go forward with the children's vaccination.
Thank you. Ms. Fernandez?
Hi, can you hear me? Okay. Well, as you already mentioned, the first concern is about how the kids can react to the vaccine. And that's why pharmaceutical companies first want to prove the vaccines with adults. After that, they want to check with adolescents because they are more likely to the adults. And after that, they want to wait until they can prove this vaccination with the kids. So that's why we are waiting so much long time for kids vaccines, because we have a lot of concerns, a lot of difficulties to enroll the patients. Since we need to share the correct information with the parents, and they can accept. I know I am a mother for one child, and I am also working with clinical trials, and I know that it's so difficult to understand what is the advantage and the difficulties with this type of clinical trials. That's why are the latest part that pharmaceuticals companies work on it. So for coronavirus in particular, we have groups that are more in danger with the coronavirus, and that's the adults. And that group is the most important and that needs to be vaccinated. That's why pharmaceuticals companies only work for the vaccination to that group. For kids, I know that by now is working on adolescents groups, and after that we need to wait until the results are reviewed by FDA and all the organizations that are working on it. And after that, we have another studies and clinical trials on kids. So it's very challenging, but I think that on my point of view, the pharmaceuticals companies are working as we already know that we need to act and work.
Okay. I'm going to ask you to one of the questions in the chat, since it ties a little bit with some of the responses from our panelists. It says, what are the most common myths about COVID-19 that physicians and medical authorities should dispel from patients and the wider community? Since some of you responded about distrust from social media and misinformation, I think that's a very good question that ties into it.
There is a whole list of myths about COVID, about treatments, about transmission, about prevention, I mean, I think that we'll need a full meeting on that. Let's start with the use of masks. I mean, we know that how that was politicized and is the first and most common and effective way that we know we can prevent the spread of COVID-19. Yet, in our society, we still find resistance and mistrust about this. Like there is a secondary gain from an industry for us to use it, or if there's some sort of manipulation to get this done. You know, starting with the most basic and then going into vaccines, which people were claiming for a vaccine. Now we have them, and we still have a large group of the population who are resistant to get it, stating that the medication is still not proven to be safe, that we are getting a chip inserted so the government can track us, when most people don't realize that the best way that government and private industry has to track us is actually our own cell phones and all the activity. They know absolutely everything we do and everything we buy, we like, we don't like, and they just sell us things 24/7 just based on that. So yeah, there's a lot of misinformation regarding treatment. You will see that every country has like a new drug of preference. I have friends from all over the world, and everybody has like this new thing that somebody claims that is a cure for COVID. What I tell everybody is most cases of COVID, they get better on their own. So if somebody's trying you to sell a panacea, the only way that I can actually prove that it works is if you use it on a hospitalized, severely ill patient. Other than that, if you're doing that on a patient who is walking and talking, most likely doesn't work because most people are getting better on their own. I mean, we know that the mortality rate is directly related to underlying conditions and age as well. So if you're using products in 20-year-old, 30-year-old people, otherwise healthy, with coronavirus, most likely that product is not really doing anything. You're only exposing yourself to the side effects of it. So yeah, there are very many myths around COVID treatment, prevention, and everything involved to it.
Thank you. Any of the other panelists wants to add on that?
Definitely. I completely agree with Dr. Burgos. We can have a session and it's going to last several days about the myths and misconceptions about the COVID, and not just the COVID, but many other things. That there's the conspiracy theory element that a lot of the people have the mistrust about the sources of information. So starting off with, many people don't believe that there's a pandemic, and well, nothing's going to happen to me, or if we're related or it's a family, I'm not going to get infected. So also, those are extremely important because that puts everybody at risk. That puts your family and other people at risk. Especially, we saw that during the large spike that we had in our community in October and November. So people thought that it was going to be only by going to large events, but unfortunately, it was having a lot of the spread of the virus through small gatherings between family members and relatives. So Dr. Burgos already spoke about many of the treatments, many of the preventive measures, and we're going to be hearing a lot more about the vaccine, which is spreading very fast and very readily available in social media and some other platforms, in which is spreading misinformation about the effectiveness, about side effects of the vaccine. Why is it produced so fast and I'm not going to be able to trust it? So one thing that it might lead to the next question, or some of the comments that they had in the chat, is how can we create that hub of real information for our patients and for the community in general? So we have to be fighting against the misinformation that comes from not trustworthy sources. So we need to kind of swim against the stream, and we need to continue doing it with a loud voice, and we need to continue doing that with the expertise and with evidence-based facts.
Okay. Thank you, Dr. Ocaran.
I think education is, as the previous, my colleague indicated, that educating the community is important, as self-care and protecting themselves and protecting the others around them, as far as the basic, which would be wearing masks and social distancing, and also gaining the information from the trusted resources, not any social media that they present false information about vaccine and about COVID coronavirus that's not a real virus. So yes, we need to educate the community.
Thank you. Ms. Fernandez, do you want to add something?
Well, in case of Mexico, also the big problem is the misinformation, because even some government give us the directions, or the medical institutions give us the right information, and others are so not clear for the rest of the population. There are so many questions related to what is important and what is not important. And the mask situation also is a common issue here, because some are using and some others think that are not necessary also with the vaccine. So I think that the most important issue that we have to learn for the following pandemics, because we didn't know that if in the future we will have another situation like this or different, I don't know. So the lessons to learn, I think that the misinformation needs to start in our home, and to start to have the information from another source that we trust on it. Not only from the government, even with our medical services, or I don't know, not only with our thinking, or I don't know, because we need to have a source and that we trust on it, and have the important information for the future.
Thank you. Okay, the next question. Based on your experience keeping our medical facilities safe, what suggestions do you have for the reopening of educational institutions? I guess along with the same questions, what step can each individual educator make to ensure that their classroom will be safe when schools reopen?
I can actually start. There are models already. A lot of institutions are already open and have been open since maybe September or October last year. Some private schools in El Paso, actually, not even talking about university level, but to elementary and middle school level, they have been open and fully functioning since that time. And actually, there has not been even a single case of a kid becoming ill, and very few from staff, and actually not spreading it into the rest of the staff or even the alumni. And the main issue, besides a lot of universal protocols that are already being used in private facilities and hospitals, etc., is accountability. Each individual must be accountable of their own health, because if we do not understand how us being sick or ill one day, and even having the slightest suspicious of having coronavirus or even other respiratory virus, if we don't become responsible for that and look and seek for medical attention and skip that day, then we're not helping anybody. So start with us, start with our own responsibility. Of course, I mean, the universal protocols that are being followed for the most part are the same that you see on when you enter a hospital. I mean, you get a group of questions, which you can easily lie to. That's why accountability should still be the number one thing to do or to follow. And the second thing is private institutions, they have the right to mandate the use of masks, which I still needs to continue to happen, mainly as we reopen educational institutions. The third thing would be for the population at risk to be vaccinated. Because if one student is sick, he misses classes or he goes back into the going back to Zoom to take care of their classes, but then the rest of the class will go on. But if one professor falls ill, then the whole class is just ruined, and then it can put other people, other staff members at risk because they have more communication with each other. So it's not the same as one student or two students getting sick as the repercussions that it will have in the whole educational system if our professors become ill, including the risk of hospitalization and death that they have because of their age. So that will be the third issue, vaccinations. Just broadly, I mean, I think that we can go deeper into the matter as the other panelists will say their opinion.
Okay. Hydarian, were you talking? You're muted.
I was waiting for Dr. Hydarian. I don't know if she was going to be speaking.
No, I was talking to my staff. They were leaving, so I said goodbye. And
Okay, sounds good.
I agree that in education, I pass by school and I see in the recess that the kids are so cute. They're wearing their mask. So that's important to wear the mask and keeping the facility clean. And that prevention will help us to prevent the spread of the virus. And that's the basic. If we everybody follows those basic steps, then the spread will be controlled. And like, I mean, in China, I have family members, they live in China, they closed the country and everybody is wearing masks and there is no cases in China right now. And in New Zealand, the same way. So if we all follow the same as Dr. Ocaranza mentioned, that the wear of mask has become politicized. This is science. This is health of the people. We need to take care of our people, not create division, and help people understand the importance of mask and cleanliness and social distancing. So yes, that's all. Thank you.
Thank you. Dr. Carranza?
Yes, definitely. This is one of the things that also has become very politicized, the return to school. And I want to give a little bit of a background and why the schools were closed at the beginning of the pandemic, because initially we saw that the coronavirus is a family of respiratory viruses that causes illness that is similar to the one of the influenza. We know that in influenza, children are large drivers of pandemics or outbreaks during the influenza season. So in a way to protect them, we needed to keep them away. We needed to learn more about the COVID virus and how it behaves in communities. In particular, we saw how it would attack in congregate settings. So schools by nature have a large number of children, several teachers that are adults. Many of them are considered to be at risk because of the chronic conditions. So little by little, as we learn more and we have more evidence in how the COVID or the coronavirus behaves, we now know that the transmission between children, especially younger children, younger than 10 years of age, is a lot lower than what it is in teenagers or adults. So given this fact, now we slowly reintegrate all these smaller children into the classroom, but we have the factor about the teachers. How can we, the teachers, create a safe environment in the classrooms? Well, it's going to be having to have a layer approach of safety protocols that starts with the mask, that also continues with hygiene that is extremely important and very difficult to achieve in younger children, because by nature, children are going to be putting everything in their mouth, in their face. They're going to be sharing things, and we want them to share. We want them to share experiences. We want them to share many things, but we don't want them to share the virus. So how can we do it to prevent that? Well, we as the teachers did a great job during the H1N1 pandemic, and how they're going to be covering the cough. How the cough etiquette in the internal part of the elbow was a great success for the teachers, because the children were doing that a lot better than the adults. So having that and educating those teachers that we need to have our children wash their hands off, and after some common activities, having to see the transmission of the virus, or learning about the transmission of the virus and how to break that transmission chain, is going to be extremely important. And the best way is very simple: just washing their hands soap and water for 20 seconds, wearing the mask correctly, having the parents send several set of masks, because a lot of the children are going to be losing their masks, they're going to be chewing on their masks, they're going to be doing other stuff with their masks. Now we know that the transmission through fomites, meaning the desk and other toys, et cetera, is not going to be as big as when you have some infected droplets. So the distancing is important when it's available and when we're able to maintain it, especially in older teenagers, meaning the high schoolers, the older middle schoolers, but it's going to be less important in younger children. So how can we keep also the teachers safe and the staff safe? Well, we need to promote that distancing between them, so they don't be gathering in the break room when they have a break. The vaccination is extremely, extremely important. So they need to get vaccinated. They need to get their chronic conditions under control. And also they need to continue practicing those prevention methods about wearing their masks, washing their hands, remembering not to touch in their face. And that's the way that everybody's going to stay safe while they're coming back for in-person instruction in schools. Higher education institutions like the community college, universities, well, they're going to be the same as all the adults, and they all need to be careful. They all need to get immunized, continue wearing their mask, and they're more conscious about the distancing and how they're going to stay safe and promote those safe practices. I think those are the key elements that we're going to be having to practice, instill in our kids, and continue to see along this coming school year in the fall of 2021.
Thank you, Dr. Carranza. Ms. Fernandez, do you want to add something?
I think that already mentioned all the important things. Also, I want to add that we need to be very aware that our normality was already changed. So even we have the vaccination for everybody, we need to using the mask all the time, even in the school or in anywhere that we are working or in other space. But the important thing is that we need to be more aware that we need to use the mask, and also to have the prevention things to be in safe, not only the kids, also the teachers and the parents. So we need to be in the same way, the school and the parents, to be safe together.
Okay. Thank you. And if all the panelists agree from now on, I'm just going to call 2 of you per question so we can get more questions answered, since we have a lot of questions coming in. I'm going to call just like 2 of you per question. So another question that we have here: how have you approached the challenge of your patients avoiding office visits out of fear?
When the pandemic started, I immediately started having the telehealth, which it is communicating virtually through Zoom or Skype. And now we have another mode that it connects to patient's chart. So we if they were sick, so we would make an appointment and virtually visit with them and order the proper test. And once diagnosed with the coronavirus or before diagnosing, still gave them as tools to monitor their symptom, and if they get worse, and recommend to have the basic necessity things like thermometer, which nobody had, and pulse oximeter, and a blood pressure. Those are the important thing as far as the temperature and your oxygenation, to check those value to see if it is dropping. Then if it is dropping, then you're in more critical. So giving them tool and also treating them with what we had, mainly initially it was a lot of different supplement like vitamin C, vitamin D, and which I made a flyer and I put it in each room to, as far as the prevention, wearing mask, must be wearing mask. And some patient, they refuse, or they left the office. They said, we are not going to wear a mask. And I said, then I can't see you. So you have to stand for the principle, the right things, and also guide them that I put flyers as far as what supplement to take to prevention. And virtually, yeah, give them tools.
Dr. Haida, since you answered about that, do you think telehealth or virtual care have a future when we return to face-to-face visits?
I think it has its place in the future, but I think we need to see patient in person. When you see the patient in person, you see how their demeanor is. You can tell by their body language, their talking. There are a lot of other things that's hidden you recognize and you may address. And the examination, even though that we learn in medical school, 90% of diagnosis is by interviewing patient, and 10% probably would be from examination. So there are certain things that you can do by telehealth, but you need to see the patient and also examine. Yes, it has a future, and it has helped us a lot to keep our patients safe and keep our patient, address our patient needs during this past year. So we never closed our office. Our office was fully functional, and we saw some half patient, virtually half in office.
Thank you. Dr. Carranza or Dr. Burgos, do you want to add something, or we skip to the next question?
Yeah, but I had the experience of keeping the office open. I don't know if my Zoom is on. Oh, yes, my mic is on. We had the opportunity to keep the urgent care clinic open. We thought that the service that we could provide at the beginning of the pandemic was important, mainly at trying to diagnose the condition as early as possible. By now, our volume is back to normal. Actually, we try to do telemedicine. We do have the ability to do so, but our patient population prefer to come and see us rather than do the telehealth. I guess because of the severity of cases and the urgency that they have with the condition, and they rather come to the office, even though we do have the option to see them virtually. Now, particularly for coronavirus, we can test them. So that is extremely important, because you need to know if you have the condition. You have to prove it with a test for multiple reasons, for isolation, for work status, etc. So it was a challenge initially, maybe the first 3 months, but at this point, everything is back to normal for us. And I think that the service that most physicians in the community provide, which is testing and evaluation, it will continue for the next year, maybe even a couple of years for COVID. And this particular service will be very rare to be supplemented by telemedicine only. Maybe as a follow-up is a good tool, but not for the initial visit and diagnosis.
Thank you very much. Another question that we have, it's related to the vaccines. Let me see. Is there any precaution we all need to take the first few days after receiving the vaccine as far as being with other people or loved ones that have not received the vaccine? Dr. Ocaranza?
Yes, and definitely, even after receiving the vaccine, we still need to be careful. We still need to be wearing the mask, and we still need to follow the proper preventive measures that we have been stressing over and over. The fact that people receive the vaccine doesn't mean that they're going to be out doing everything and giving that opportunity or increasing the risk of becoming infected. So the people need to be extremely careful in how they handle this themselves. Some people, after receiving the first dose, they still test positive for the COVID and they get the disease. So they need to be conscious about that. They need not to be visiting those that are at risk and they haven't received the vaccine. So we're still not there yet in terms of reaching herd immunity. So until then we need to continue having proper precautions.
Thank you. Okay,
One of the
Okay.
questions that actually was following that particular is if people become carriers after receiving the vaccine, and the answer is no. Remember, for the vaccine, at least for the vaccines that we have here in the US, we're only using mRNA particles and they trigger an immune response, but at no point in time we are getting the virus injected, so we do not become carriers with the vaccine. Now, we can be carriers just because we got exposed in the community. People need to remember that even after your second dose, even after developing immunity, doesn't mean that you will not get the virus. You can actually get the virus. You can become ill by the virus. The whole idea is to decrease the severity of the infection and hopefully mortality. That is the effect of the vaccine, that we do not get severely ill by COVID. But we can still spread the virus if we're not careful. So we do need to continue to take care of ourselves and our loved ones, even if everybody's vaccinated. We do have a little bit more freedom because we know that if we will not get severely ill, but we can still spread these, and we have to be careful of people who are not vaccinated because we might make them ill if so.
Thank you, Dr. Burgos. Another vaccine question. How long are we protected once we're fully vaccinated?
There is data out there, and remember, we are learning as we are doing things. We do not have definite answer for that. From the first trials, data indicated that the immunity was still good after 8 months. We know that even though we check numbers, there are very few labs in El Paso where we can actually quantify the amount of antibodies that you have. It doesn't necessarily tell us which antibodies are this and how effective they are. Of course, if we learn from other similar vaccines, we know that it's going to start decreasing after a certain point in time. So at this point, we are telling people that 6 months, maybe a year, maybe a little bit longer, but we do not have complete data on that. The trick is we need to get vaccinated at the same time. We all need to get vaccinated within a period of time so we can create the herd immunity and we can actually protect the rest of the population that is not a candidate or cannot get the vaccine or who doesn't want to get vaccinated. But we can only achieve that if we get vaccinated within a period of time so we can all have good immunity during that time. If we start staging that, which actually is not the case of the US, fortunately, I think that in the world, we have been blessed with the fact that we have the vaccines. Every city is deploy a very aggressive pathway to get as many people as possible vaccinated. I think El Paso did a tremendous job with this. And as a country, we are going to be very strong in this, so we can achieve that. having said that, not every country, unfortunately, is the same for several reasons. And we will see countries where only small percentages of the population are going to get vaccinated. That is not going to work. I mean, if people think that they will be protected, they won't. I mean, if we don't get as many people as possible, unfortunately, the community will not be sufficiently immunized and will not be protected, and the virus will be hard to die. That is why this needs to be a global effort rather than a local effort. And I mentioned that, and I want to bring this because we live in a border town. And the fact that Mexico is not providing enough vaccine to their population, and we have our sister city in Juarez so unprotected from vaccines, is going to affect us at some point, because right now we are like almost 800,000 people in El Paso. Once the borders are open again, we're going to come back to be the binational community of almost 3 million people, where now we're going to have 70% of them unvaccinated and, you know, going back and forth. So our efforts locally, they must also include our border sister city of Juarez. Otherwise, we will not reach our goal, you know, anytime soon. And it has to be a global effort, by the way.
Thank you, Dr. Burgos. Also related to vaccines, what are the mitigation efforts in place to combat the new variants of COVID-19? And it is projected that the current vaccines in place and will be effective against those future variants. Who wants to?
I guess I'll.
Oh,
Sorry, or Ms. Alao can go ahead. That's fine.
okay.
No, go ahead. Go ahead. Okay. Well, by now we know that some of these variants are covered by some vaccines, but the pharmaceuticals now is working with the vaccines to prove that they are covered for the actual vaccination, but we don't have all the true about the coronavirus and all the varieties. So we need to be aware that as if we have the vaccine, we need to be very sure that we are not 100% protected, because we have a lot of variants and we didn't have the certain that is covered. But I know that the pharmaceuticals are working on it. So by now we don't have all the information ready to be very sure. But what we already say here, even if you have the vaccines, you need to use the mask and have all the prevention skills.
Thank you. Dr. Carranza, you want to add something?
Yes, definitely. The best way to avoid the variants is to get immunized right now. We know that the virus is going to keep changing and it's going to be mutating. So it normally mutates every day, and until we have a large mutation or a very significant mutation, it becomes a variant of interest or it becomes a variant of concern. So many of the vaccines that we have available are still covering some of the most common variants, but we need to do it fast and rapidly so we can promote herd immunity. We need to continue being cognizant that if we're going to be traveling, we need to observe the measures that we have mentioned before, which are so simple, by wearing the mask, by washing your hands. And if you don't need to travel and expose yourself to large amount of people and gatherings, then don't do it. That's the way that you're not going to be bringing this variants or the virus back home. And it's not only for COVID, but many other viruses and other infectious diseases. So what we need to do, in essence, keep doing what we're doing. Wash your hands, wear your mask, stay home, and get vaccinated.
Thank you, Dr. Carranza. Next question. What percentage of the El Paso population is diabetic of the total number of individuals who have passed away from COVID-19? What percentage were diabetic? Do we have those numbers, Dr. Carranza? I might need a little bit more research.
Actually, there's many studies, but as we know, a lot of the people don't have the means to go and get medical care in El Paso. That's one of the social determinants of health that we need to address in El Paso. And it is a very complex issue because there's people that just go by medication in Mexico. There's people that don't have the means to or don't access the healthcare here in the US. So we do know that there is a very large percentage of people with diabetes, even larger percentage of people with pre-diabetes. We know that over 95% of the people that have passed away due to COVID have pre-existing medical conditions. And the best tool that we have if people want to access some of this information and data is at epstrong.org, where we have put the dashboard with a lot of nice information that it can become very granular. The information about how many people have passed away that has diabetes is there, high blood pressure, cancer, lung conditions, and actually high blood pressure and diabetes are the two largest percentage of chronic conditions in people that have passed away due to COVID. We know that the risk of dying or passing away increases over 100-fold when you have the two conditions, the diabetes and the high blood pressure, if you get infected with COVID here in El Paso, and based on the study that we have done, epidemiological studies. So it is extremely important that people control their chronic condition. We know that diabetes is quite common in Hispanics, and we know that 35% of the population in El Paso is Hispanic. We're the number 2 in diabetes in the whole country in the US. So as we tell the patients, is not that if we're going to be getting diabetes, it's when we're going to be getting the diabetes. So we need to take care of ourselves. We need to control the condition if we already have it. And if we have somebody, a loved one that has diabetes, high blood pressure, make sure that they access the healthcare, that they have access to the medications and access to the other elements that are going to help you control those.
Thank you, Dr. Carranza. Next question. What is currently known about why so many COVID-19 survivors continue to suffer long-term symptoms?
By now, we have been able to describe several long-term syndromes related to COVID, and they're all very different. Remember that we still do not understand how this virus thinks. I tell people that this virus has a brain on its own, and it works very randomly when it attacks somebody's or some person, right? Some certain type of people. So one of the syndromes is called the long COVID syndrome, where people actually have decreased energy, intermittent headaches. Some people experience still the anosmia, which is the lack of ability to recognize smells and flavors, and it lasts for a few months. We do not know still how long they last. I have seen patients who have experienced symptoms even after 8 months. We know that there are even acute complications after the virus, including myocarditis, which is an inflammation of the heart, arrhythmias that can develop after that. And so there are several things that happen. Remember that this virus creates an inflammatory response, and that is actually the dangerous thing about the virus. And it's what people tend to forget. Is the virus is already killed by the body within 10 days. That's why the CDC recommends that after somebody is asymptomatic, 10 days after initiation of symptoms, to break isolation, because the virus is far gone. And actually, most symptoms most patients who end up in the hospital, they develop symptoms starting severe symptoms after day 7, day 10, or even day 14. By then, the virus is already out of the body, and then we are just dealing with a severe inflammatory stage. So once you have all those cytokines, inflammatory chemicals in your body, then it's up all in the air. I mean, we do not know what the long-lasting effects are, even if there will be some immunological complications in the long run. We are still learning about the virus. We are still learning about the side effects that it has. And we're collecting data every day. We're examining people every day. We're trying to get information and see what is it that the symptoms are, how long they last, and what can we do in order to make them better. So yes, there are some long-lasting side effects. Unfortunately, at this point, we do not have any treatments available for some of them because they are not secondary to the virus per se, but secondary to the inflammatory response that the virus trigger in that person's body.
Thank you. The other question is, given the diversity of the panel, what are the ethical and real implications of less developed countries not receiving the vaccines? Anybody? Nope.
Yeah, well, it's what I mentioned before. If we can be protected and we know that our protection will have a certain duration. Now imagine some of us traveling to those countries where they are not vaccinated. As Dr. Carranza mentioned, if we do not get vaccinated and the virus is perpetuated in that community, it's going to create variants. That's why we're putting names to the variant, the Brazilian, the South African, the one from London or from the UK, because it is mutating the most in those particular area because the virus or the infection rate is not being controlled there. So if some places are not massively vaccinated, the virus will continue to aggressively mutate in those places. And guess what? Maybe a year from now, when the US is winning on the immunity, we're going to get attacked by that particular variant. And we'll have a nice honeymoon period where everybody's vaccinated. We'll be a year and a half without any diseases. And then guess what? COVID-21 comes in and attack the US because that variant came from God knows which other country. So that's why I insist that vaccination must be a global effort. Otherwise, we will end up back to square one at some point in time. In El Paso, and actually one of the questions that I was reading from the spectators was about other health issues important in the community other than COVID. Well, the fact that we are a border town and we have this massive migrant caravans coming to El Paso, it creates another healthcare problem because not only for COVID, but other viral and transmissible conditions and diseases can come with the migrants. So the efforts on the immigration politics and the agenda must include public health more than ever. So we have to ethically analyze the ability to vaccinate a lot of the people who actually cross the border, so we can protect ourselves, not only them, but ourselves, and to do more aggressive health screenings in order to achieve the same matter, which is to protect ourselves. The US has a very strict plan to do a physical, healthy evaluation for most endemic and transmissible conditions when somebody comes to the US and becomes a resident or a citizen, but we're not following the same rules for people who are crossing the border and they are being held by our security staff, border patrol, etc. So we need to create those, the same rules that will apply for somebody who is legally migrating to the US. We have to do the same and follow the same rules. And we need to pay the price for that. Otherwise, we're going to end up paying the price of having, everybody sick. So that is one of the main issues that we have in the border, and it's related to a federal issue, which is immigration, more than a county level or state level even.
Okay, thank you. Since we're talking about other countries and international, from your experience, who is making the greatest advancements in preventing and treating COVID, and what are they doing? So this might relate to either national, state, or local level within the US or outside the US.
Well, I think that it's not a matter of who's making the most advances. This has been a world collaborative effort in which many countries have done a wonderful job in doing extensive research. The diversity of the population of each country, that's what enriches some of the research that is being done. So it has to continue being a collaborative effort between a lot of the countries in the world, making those advances in the fight against the pandemic. And nowadays, we know a lot more than what we knew probably a year ago. So we need to continue making strides and learning more. So that's the way that we're going to be able to fight effectively the pandemic, help those in need, and address those disparities that have become very evident as we move forward with the pandemic.
Thank you, Dr. Carranza. And I'm going to kind of group 3 questions that I see that we haven't answered from the chat. One of them is, what is currently known about why, and I'm sorry, it's about the vaccine that I saw. What if a person starts with vaccine 1 and does not get the second shot? Is there still a partial protection? The other one is, what are the masks that you all recommend? And then if we have special groups of students that are not very clean, how do we address or approach them? So kind of 3 questions still on protection.
With the first vaccine, as I read, about 40%, it initially starts protection after a few weeks, developing some antibody, but you need to have the second dose of vaccination to be at 95% protection. Like there is a vaccine that Johnson Johnson that it gives about 69 to 70% protection. You get some protection, but it's not, you can get the virus. And as far as how bad the symptom would be, that we don't know. And as far as the mask, I think the best is to any mask, even cloth mask, which protects a little bit, but I think the surgical mask would be better if you can. Now it's very available. Before it was very in shortage, or so that would be good. And going back, I think it's a global issue. I agree with Dr. JDB. I forgot your last name.
Burgos.
And Dr. Carranza. I think we should look at this globally, and I wish all the leaders of the countries would come together and sit on a table and discuss this, and then give vaccination to equally to distribute it to the other countries. Like United States should be the leader and would provide vaccine for other countries, like they should be providing for our sister city Juarez, or people who are coming as a caravan. They are human beings, that they're like our brothers and sisters, that we have to take care of them. So we should initiate. I wish the politician would come together and create a plan for this, and not just be selfish that all US gets all the vaccine, which I was reading that there is a curve that Israel has got the vaccination by 60%, then United Kingdom about 40, between 40 to 50, and Chile, and then United States and Bahrain, they're about the same as far as how much they have given vaccination. The rest of the world is really low, below 20%, 10%.
Thank you, Hydarian. So the other 2 questions were how to deal with the group of people or students that do not follow like the cleanliness and social distance mask, I guess, and what is the best mask to wear?
Well, educating the children, cleanliness is important. From childhood, we learn that you need to wash your hand before you come to the dinner table, wash your face. So the same thing applies in pandemic, in situation that when you're in a group of people, you need to come clean and wash your hand and protect other people, respect other people and respect yourself. We have to teach our children and students that by respecting yourself is keeping yourself clean and healthy.
Thank you. Okay, and then another question, what happens if you lose your vaccination record?
I let the other doctors answer.
Dr. Ocaranza, what happened?
Well, actually, I lost my card, so I can tell you from experience. I went back to the place where I got it, and I got a copy of it.
Great, thank you. That's the answer. And I guess the one that we haven't answered is about what masks are recommended. Dr. Ocaranza?
Yes, actually, there's been studies nowadays done on mask and effectiveness. And what we know is that, first of all, the material that you need to do the mask has to be a material that is not as loose woven as you can see the sun if you put it against the sun. So the material that you need to use is the material exactly. So you need to look it up and see if you see the sun and everything else through the mask, then it's not going to be effective. But you need to have different layers and at least have the 3 layers that you can build your mask. Dr. Hydarian mentioned the surgical mask, and that's a great alternative if people have the money to buy it. We reserve the N95s and to healthcare facilities and healthcare professionals when they take care of patients. And that's what we recommend for the community in general. If they make their own, just try to make it with tightly woven material, put different layers, and wear it correctly. That last thing is a key because we've seen many people that wear the mask in many different ways, and they wear it in the bottom, they wear it in the just underneath the nose, but it has to cover the nose and the mouth completely and around the chin.
Thank you, Dr. Ocaranza. I think we've answered all the chat questions. Thank you so much. And except one, it was one of the first one, but I left it for last. Since we've been focusing everything on the pandemic and COVID, the question was, other than the pandemic, what are other health pressing issues here in the border? And I'm gonna go one by one, and if you wanna add any, answer that question and add any final remarks. And I'm gonna start with Ms. Fernandez.
Well, in case of Mexico in particular, I think that with all this pandemic situation, we see that we have a lot of health issues that needs to be covered. As you know, here in Mexico, we have a lot of people with diabetics problems and obesity. So I think that with this pandemic situation, institutional all the institutions are aware now that these illnesses needs to be covered and needs to educate to all the people to know that we need to be very aware about the situation. So as far as I know, here in Mexico, both are the most important things that needs to be review and aware by the government and also by all the people. We need to be very aware about our safety, our health. We don't need to be wait that the government say something. We need to be aware about our health, in particular with diabetics and obesity.
Thank you very much. Dr. Burgos?
Yes, and actually, I believe Dr. Carranza mentioned this before. To me, besides the coronavirus right now, the 2 main problems or healthcare issues that we have, first of all, is access to healthcare, and the second one will be education and how to fight misinformation. Those 2 issues are definitely relevant and important right now. First of all, and hopefully whoever, the public who are listening to us right now, I want them to serve as multipliers of information. I want them to spread this information. I've heard a lot of people saying that they are afraid to go see a physician or to go to a hospital, even if they are very sick with COVID, because first of all, they are afraid to die in the hospital. Second of all, they are afraid of the bill. So answering this particular point, first thing is, if severe cases of COVID do not get to a hospital, actually the likelihood of dying from it is extremely high. The only way to avoid this or to try to decrease its chances is to go seek medical attention as early as possible. Timing is of essence. And then the second issue about the bill is last year, and actually this bill was renewed this year, any expense related to COVID is minimized or it is mitigated by government bills. So if somebody, for example, they go to a clinic and they have a COVID diagnosis or a COVID-related diagnosis, for the most part, they are not required a co-payment if they have insurance. And if they are fully uninsured, there are plans where they don't have to pay for the medical service or the medical visit, even for the test. This applies for hospitalizations as well. There are a lot of federal bills that are helping protect patients who suffer from COVID. So my message is, first of all, get medical attention. This will fight the misinformation. And the second problem about healthcare access, at least for COVID, is that there are programs that will help protect the patients so they can receive medical attention emergently and in the office. So they need to understand that they have these bills in place. That way they can access medical facilities and medical treatment as early as possible.
Thank you, Dr. Burgos. Dr. Hydarian.
I agree with Dr. Burgos. I think education is important, first of all. We need to educate our school, our children, our community, our family member, as far as self-assessment, self-protection, first protecting ourselves, protecting the community by keeping all the basic things as far as being this, as they mentioned, social distancing, wearing masks again, and if you have the symptom, having the basic necessity things, thermometer, pulse oximeter, blood pressure. If you get those symptoms, immediately check your self-assessment, and then calling the physician. And there are always, we work with our patient. If they can't afford it, we can see them without payment, or have payment plan, or the government, as Dr. Burgos said, has plan and they pay for the testing of the coronavirus. So there are means available to help the community, that they don't have to stay home and to seek attention, the doctors, healthcare providers' attention.
Thank you. Dr. Ocaranza.
Thank you very much. As mentioned before, we in our community have issues with social determinants of health. The social determinants of health is how we access the healthcare, how we're going to be transporting ourselves to get the healthcare, everything surrounding our home. How do we pay for the services? Where do we access the services? How we're going to be either getting insurance to access the healthcare. So the state of Texas is one of the states with the largest percentage of population that are uninsured. In El Paso, that problem is even higher. We have people living in multi-generational homes where also the access to healthcare is extremely limited because of the language proficiency, because of the way that they're going to be accessing the healthcare, because we have a health professional shortage area. We don't have that many healthcare providers that are going to be treating those patients. So it is a very complex issue. It is a very complex task to tackle. And the way to do it is, as a community, having to look for those people that don't have access to healthcare. Let them know about the resources available. Let them know how they're going to be able to access those. and lending a helping hand. That is the most crucial part. And we as a community have done a great job in providing that. We're very welcoming. We help our neighbors, we help our loved ones. And by helping each other, we're going to be also doing that in the healthcare arena. So social determinants of health is a big part of why we do not access healthcare. But little by little, we can break those and we can make it more accessible.
Thank you very much to all 5 of you. I think we all learned from clinical trials to international health, all the efforts for the pandemic, and also some kind of responsibility that we as educators have to transmit to our students as far as being accountable and responsible. So we really appreciate you all for all the knowledge brought in this session. And I don't know if Crystal has any final announcements.
I would just like to really share my deep appreciation for all of this information today. I think that we can tell from the information we received in the chat and the questions we received that this was incredibly helpful information, not just for the audience here, but for our media audience, but for the extended audience and those that we will share this information with. Thank you so much, because we know you are incredibly busy at this time. And we really appreciate your attention and the time you've taken to this panel. Thank you so much. So our panel now has reached its end. We will be closing this session shortly so that we will move on to the next link, to the next presentation with Dr. Eduardo Arellano from UTEP. So please join us. The link is in the chat. We will be closing this session shortly. And once again, just a huge thank you to all of our panelists and to our moderator, Loreli Ambris, for their time and attention today.
Thank you very much for allowing us to participate in this program. And it was a very good program. And thank you for other physician, Dr. Carranza, Dr. Burgos, and Dr. De La. It was nice to meet you all. Thank you.
Likewise, thank you very much. And thank you for having us. Thank you to the Community College and all the wonderful people that work there.
Yeah.
Thank you very much. I mean, we really need to continue to make the effort to educate the community so we can fight this. That is the main weapon we have in order to fight this and any other condition. I guess the pandemic that will stay for long, for the longest time is misinformation and lack of education. So we all need to fight together to beat this one.
Thank you so much. I'm so glad to be with you. I think that this type of conferences are very important nowadays with all these situations. So it's so important to have this communication between all the global, and I thank you so much for this opportunity.